Well, get your legs summer ready with help from Dr. Robert Cutchen joining us today from the Albuquerque Vein and Laser Institute. Good morning.
Good morning. It's good to be here.
I didn't realize you also had a skill of singing.
Yeah, we're just working on our Scotty McCreery here for a minute. So.
Yes, yes. Will you do it for us?
Baby, shut them door and turn the lights down low.
Oh my gosh, I love it. I love it. I love it.
I don't even think that's the right.
American Idol. That's it.
I don't think those are the right lyrics, but it's something like
whatever it is. It was good.
All right, well,
it was good.
See?
And another
got to be famous for something,
you
right?
You do.
For hammer into
well, Dr.
Scotty
Cutchen,
McCreery lyrics.
You're a man of many talents, clearly. Not just a great singer, but also a man that really knows how to give us the right advice about making sure that our legs look their best and also that we stay healthy. So let's talk a little bit about why now, even though it's not summer yet, is a great time to get our veins treated.
Now's the time exactly to think about 6 months ahead. And the reason is because when it comes to addressing our legs or varicose veins or spider veins, it's not something that's necessarily an overnight treatment.
Right.
A lot of treatments are done, everything is done quickly and in the office and things like that, but there's always some healing time, and when we're talking about spider veins and stuff, it takes some time for things to fade away.
Right.
So if you want your legs to look good and be ready for the swimming pool this summer, the time to start working on it is now.
Yes, and let's differentiate for the viewers so they understand the difference in what you're looking at when we talk about varicose veins first and foremost. What are they?
So varicose veins are essentially broken veins. They're veins that aren't working right. And the job of our veins is to carry the blood up and out of our legs, back to our heart, so our heart can pump it again. And varicose veins are essentially veins that are broken. Little valves inside the veins have broken, so the blood's flowing backwards down those veins. And all that back pressure is what makes some veins bulge out. And all that backwards pressure in the veins is what causes people's legs to feel heavy and achy and tired. And some people have burning or itching and things like that. And that's what causes the symptoms.
And it's common, right?
It's really common. The reality is probably somewhere between 15 and 25% of people have varicose veins.
Yeah.
Probably a little bit more common in women than men. There's a big family tendency.
Right.
So I got my
genetic.
varicose veins from my mom, and my kids are probably doomed for that same reason.
Well, you know, as we talk about the fact that it is a problem for many people, we also need to talk about the treatment. So how are varicose veins treated?
The good thing about varicose vein treatment is that everything now is done in the office. There's no more going to the hospital, no more being asleep in surgery. Everything's done with our patients awake. If we need any anesthetic at all, it's local anesthetic.
Good.
Veins that were previously treated with vein stripping, we actually now close with a laser that we put inside of the vein.
Wow.
And we can actually put some local anesthetic in and burn the vein with a laser, and we leave that vein in the leg, and it just disappears over the course of time.
So there's really not a lot of downtime.
Very little downtime.
Well,
very little downtime.
Are spider veins very different from varicose veins? Because you and I have talked about this, but a lot of our viewers might not understand.
And spider veins are different. Spider veins are those fine little red, blue, purple veins, and they're typically very, very small.
Right.
And they typically don't cause a lot of symptoms. Sometimes people will complain they're a little stingy or something like that, but they're not causing that real heavy, achy feeling. And spider veins are treated with sclerotherapy. And sclerotherapy we're seeing here is the injection of a liquid chemical called sotradecol or polydocanol into the vein, and it's going to chemically damage that vein and close it down, and the vein is going to disappear.
Wow.
And
it disappears temporarily and then again permanently, right?
And these images are a little misconceiving because the vein disappears immediately when we inject them right here because we're pushing a clear liquid into the vein.
Sure.
But they actually take several weeks to completely disappear, and some areas are going to require multiple rounds of treatment. That's why I'm saying now is the time to prepare for the summer, because large clusters of veins, we're going to have to hit those multiple times. So we'll hit them and they'll fade some, we'll hit them again and they'll fade some more, and we're going to slowly fade those out. And,
so you want to give yourself enough time. And now you also have something, it's called Vein Wave. Will you explain that to me?
So the Vein Wave is this really neat new piece of equipment that we brought into the office. And we've got a little video of that too. And basically it uses radio frequency energy to close veins. There's a little handheld device. It's got a tiny, tiny little needle on it. And we're not actually injecting anything here, but rather you just barely poke this just under the skin and press on a little foot pedal, and it delivers some energy into that vein.
Now, does that hurt?
You know, it feels a little pokey, but it's not too bad. I've had it done to myself, and it's not too bad at all. But it kind of zaps those veins, and this actually is a fairly fast procedure as far as making them fade. I had a friend come into the office a few weeks ago, and we he had a pretty decent-sized little vein on his nose that we treated, and I saw him about a week later, and it had disappeared. And it's really neat technology, and a lot of people have these on their nose or on their cheeks, and and they can be pretty bothersome to people, just kind of cosmetically. They kind of feel self-conscious about them.
And it's comforting that you have that option. I think a lot of people don't realize that they do. And another thing I wanted to ask you about is because if they do decide they want to go in and treat, a lot of people are concerned about the finances. So
Right.
are these treatments covered by insurance?
So the large varicose veins, for something to be covered by insurance, it has to cause symptoms of heaviness, achiness, tiredness, things like that. And we have to have objective findings when we do an ultrasound exam that tell us that the veins are essentially broken, that the blood's flowing backwards. And if we have that combination, then it's considered a medical problem, and we are able to bill that to insurance. Now, these cosmetic things where we're looking at the spider veins on the legs or on the face, that's always considered cosmetic, and nobody covers it. We wish they would, but they just don't.
But it's worth saving up for, because obviously people want to look their best and they want to feel good too. So you're actually offering something really nice. This Thursday you're doing a screening, right? So what's the process?
So our vein screenings are a free appointment. It's about a 10-minute visit where we can come in, take a look at your face, take a look at your leg veins, whatever you want to look at. And we can talk about if we're looking at more of a medical problem or more of a cosmetic problem. And so our number right here on the screen is 848-VEIN or 848-8346, and you can reach us there. You can also find us on the web at albuquerquevein.com, where all these same topics are discussed.
Fantastic. Well, Dr. Cutchen, thank you so much. Definitely, if you're concerned about this, head out there on Thursday. It's so worth the free screening. And I'll be talking to Ryan Seacrest this week about you.
See if you can get me on.
Okay, I'll work on that.
I think I'm past the age limit, unfortunately.
Age limit, schmage limit, who cares? Coming up next, designer Nicole Richie is getting us red carpet ready. Don't go away.